Well, the other big story today, COVID is making a comeback. Cases of the new Omicron subvariant called JN.1 are rising worldwide. In the wake of the surge, the World Health Organization has urged nations to continue with measures to curb the virus. In India, too, 142 fresh cases have been reported across the country. The southern state of Kerala has reported the highest number with 115 cases and 1 death. Another death has been reported in Karnataka. The central government has issued a vigilance advisory to all states. Karnataka has now made masks mandatory for all citizens above the age of 60. Among the several nations witnessing this rise, Singapore has recorded 56,000 more COVID cases in the last week up to December 9th. Cases have risen from 32,035 in the previous week, and the vast majority of cases are infected by the JN.1 variant. This has prompted the Health Ministry to issue an advisory for citizens and for travellers alike. Well, in Europe, the UK is now preparing for a potentially devastating wave. Experts have warned that the new wave here could be one of the worst since vaccines were created. Cases are spreading as immunity levels are waning. Almost 6,000 people have tested positive throughout England in the week of December 9th. This marks an over 38% rise compared to the previous week. Moving on to Germany. Here too, the infections have reached the highest level since June 2022. The JN.1 subvariant is reportedly responsible for almost a third of the cases, while the risk to the general population has been deemed low. Here too, the Health Minister has urged people to get their vaccinations topped up. In the US, 17 states have reported high to very high levels of respiratory illness activity as COVID-19 and other flu hospitalizations have increased. And according to the data published up to December 9th, COVID-19 hospitalization rose to over 24,000. An alert has been issued to healthcare providers, encouraging them to administer COVID-19 and flu vaccines as soon as possible. Meanwhile, China has detected several cases of contracting the subvariant of the JN.1 in about a month. And according to the health authorities here, infections in China are at the low epidemic level. However, experts have warned that more cases of the variant are expected. The JN.1 subvariant is a descendant of the BA.2.86 variant of the COVID, commonly referred to as pyrola. Symptoms of the infection include fever, nasal discharge, throat infection, migraines, and mild gastrointestinal issues.